Good afternoon, and thank you for joining our webinar today, MIPS Promoting Interoperability and HIE Measure Resources. So today's presenter is myself, Selena Williams, and Phoebe Nails. Today's topics is Promoting Interoperability Highlights, Focus on Health Information Exchange Measures, and HIE Resources. I'm going to turn it over to Phoebe to discuss these topics.
Thank you so much, Selena, and thank you all for joining us. We're glad you could be with us today. So we've been in this quality payment program for quite a few years now, and many of you are, I would consider, experts, but it changes every year. And so we just want to provide a few reminders and remind you of some of the resources that are available to you on this one category of promoting interoperability, which if you choose to report it is weighted at 25% of your score. And sometimes it helps a whole lot, especially if quality isn't as robust as you would like it to be for reasons beyond your control. So as we move on to our next slide, we will talk about why are we focusing on promoting interoperability in general? And what are some of the benefits? Because sometimes it helps to know why you're doing a thing, to trudge through all the details that it requires and see the benefit of it. So using your electronic health record system and implementing the promoting interoperability measures really is designed to enhance the quality of care and overall patient satisfaction, which can lead to increased referrals, increasing your profitability as a practice, a better reputation in the medical community and with patients. And so other benefits also include streamlined workflows potentially and reduced administrative work, because so much of the record keeping that we used to do manually can be done in the electronic health record system. It can also increase clinician productivity, efficiency, and accuracy, especially around the e-prescribing. We take it for granted now, but remember when we used to have to decipher doctors' handwriting? And so e-prescribing is great for that. Improved interoperability and communication within the healthcare team, even within your organization, having access to the same information for each patient is a benefit. And then, of course, sharing it externally when you refer patients out. So these are just some of the few results. I really appreciate the care coordination part, where you can share information securely with other providers that you refer out to or that refer patients to you. And then there's something that we really came to appreciate during the pandemic, where information can be utilized and gathered for population health management, and even planning for utilizing the information you've collected for greater population management information analysis. And also, it's great for coordinating care with patients who have chronic conditions. Many of you are aware that we did a project a while back around hypertension management. It's such a prevalent chronic disease, and how some practices were able to utilize the data they had on their patients to catch those who might have fallen through the cracks by running a report to say, okay, who has several readings of elevated blood pressure that maybe hasn't come back in for an appointment. Maybe they missed their follow-up appointment, so that you can reach out proactively and help those patients maintain their health and manage those chronic conditions more effectively. So these are some of the reasons why we wanted to focus on promoting interoperability. This is the patient level, practice level benefits that sometimes get overlooked when we just think about reporting. So as we move on to our next slide, we're going to see what the categories are, just a very high level review of the 4 objectives that make up the promoting interoperability category, and what they entail, what your options are. So, of course, everyone is used to the electronic prescribing pretty much, and now it's also required that you query the PDMP in Georgia. prescription drug monitoring program. And so we're going to skip down to provider to patient exchange, that patient portal that you either have great success with, or it can be a struggle depending on your patient population. So some practices have become proactive in that they have an intern or some volunteer from the community or a person that in their office to actually use maybe a device to help the older patients sign up so that they can at least create an account and hopefully in the future utilize it. So that's one way that people have improved that participation with the patients. Also, public health and clinical data exchange is required to report at least the 2 measures for immunization registry or electronic case reporting, unless there are exclusions that accompany this measure. And then the optional ones are reporting one of the following: syndromic surveillance reporting, public health registry reporting, or clinical data registry reporting for bonus points. Now we pop back up to health information exchange. So here are our 3 options. You can support clinical, we didn't want to move forward quite yet. We can support electronic referral loops by sending health information using your electronic health record. Also by receiving and reconciling health information into your patient electronic health record. Another option is health information exchange, bidirectional exchange. And that would require using a health information exchange. And we'll talk a little bit more about that as one of the resources that we want to make sure that you're aware of a little later on in our presentation. And then this one's new, enabling exchange under TEFCA. I'm like, what in the world is TEFCA? I had to do a lot of reading to figure out what is TEFCA. And so we're not going to dive deep into it because it really does apply for now more so to the health information exchange networks. But it's a great thing for practices because it will really expand the ability to access information for patients. And Selena's going to tell us a little bit more about how we are working to make it more available to providers in Georgia to access patient information from all across the nation. So let's move on to who is automatically reweighted in the Promoting Interoperability category. All small practices. So 15 or fewer clinicians in your practice, that means you are under this special status and will receive an automatic reweighting for the Promoting Interoperability category, as well as if you fall under any other of these clinician types. Also, if you're an ambulatory surgical center-based clinician, hospital-based, non-patient facing. However, if you're part of a group, your clinician's part of a group and they report anything for PI, any submission of Promoting Interoperability data cancels the automatic reweighting, and your Promoting Interoperability will be part of your final score weighted at 25%. So this is something to consider. So a few reminders as we move on. Under the e-prescribing category, just calling out a few of the details that are listed in the measure specification. And I really want to encourage everyone to every year review the measure specifications for each measure under each category, because, you know, the devil's in the details. And so we don't want to miss anything that might be important to our success. So this was interesting to me that paper prescriptions are not to be excluded from the denominator of your prescriptions. And if you do claim an exclusion for this category, the 10 points that would have been assigned to it will be redistributed equally between PHI-1 and PHIE-4, which is support electronic referral loops, is promoting interoperability, HIE-4, by receiving and reconciling, and HIE-1, support referral loops by sending health information. So actions included in the numerator must occur within the performance period. So whatever 90-day performance period you select, or if you choose to do a year, the numerator must occur within the performance period. And of course, we always want to help you guys be prepared in the event you are randomly selected for an audit. We always want you to be prepared. So to save for audit, capture a dated report or a screenshot of patient prescription record that indicates the number of times where electronic prescribing was performed. And also, when you query the PDMP, Prescription Drug Monitoring Program, for at least one Schedule 2 opioid or Schedule 3 or 4 drug electronically prescribed, use data from your certified electronic health record technology to conduct a query of a PDMP for prescription drug history. And this is a new MIPS requirement, and we have the resource in our resource list for you, as well as here is the link. But I'm really sure you guys are already doing this. As we move forward, under provider to patient exchange, on our next slide, we also want to be audit ready, audit prepared. Save a dated report or screenshot that documents the number of times that a patient or authorized representative is given access to view, download, or transmit their health information. For example, if you give the patient instructions on how to access their patient portal, such as the website address they must visit, patient's unique and registered username and password, and a record of the patient logging on to show that they can use any application of their choice to access the information meeting API technical specifications. So you can check with your EHR vendor to make sure what API technical specifications they have enabled in your system that you can share with your patients so that you can meet this requirement, and also save the evidence of this to be audit prepared. Mm-hmm. So as we move on to our next slide, public health and clinical data exchange. So required under this category is, of course, immunization register reporting to GRIS, Georgia Registry of Immunization Transaction and Services. And also required is electronic case reporting. So you, through your electronic health record, and you can check with your vendor to make sure that this is enabled and that you can generate the evidence or the proof that you are in active engagement to electronically submit case reporting of reportable conditions. Under this category, there are, under this measure, there are optional bonus measures. Okay, let's get the words right. Under this objective, there are optional bonus measures that you can do in order to get a maximum, total maximum, no matter how many of you do, of 5 bonus points. And so to be audit prepared for this one, make sure you have a dated report or screenshots that documents your successful registration or submission, transmission, that includes the MIPS eligible clinician's name, NPI number, their practice name. Also satisfactory to meet audit requirements is a letter or an email from the registry or public health agency confirming your registration or that you've submitted data to them, including the date of the submission and the name of the sending and receiving parties. So again, we want to pay attention to the little details so that we are prepared in the event we're selected randomly for an audit. And also, it helps you keep track of the patient data so that you can be proactive in making sure that all of them receive the required and updated immunizations. Of course, there are exclusions to this measure. If you don't give immunizations, you can take an exclusion. And again, all that detail is in the measure specification sheet. So check it every year to make sure that if anything changes, you are in the know. And of course, we do our best to try to keep you in the know as well. So as we move on to our next slide, again, this one is just a review, a rehash of what the measures are, what's required, and what is optional. This is the list of the required ones. And so when it comes to option 2, health information exchange, bi-directional exchange, we have a little more information for you on that one. Because I think everyone is in communication with their electronic health record vendor to do the things that are required to send the referral and receive referral information. It is not exactly easy for some, depending on the functionality that's enabled in your electronic health record system. But it does say just for at least one transition of care or referral. So most times we can make that happen. So again, why the emphasis on this particular option, bidirectional health information exchange? Let's look at our next slide and we'll see some of the benefits of bidirectional health information exchange. And it's really something that Health and Human Services, CMS, Office of the National Coordinator, all these federal agencies are trying to move the needle towards more and more because of the benefits. So, secure exchange of patient information, improving the quality of care through coordination, and also this supports continuity of care. Because imagine you have a patient you've referred out for labs, and the results come back to you and are incorporated into their record so that you can then follow up and ensure that that patient gets the additional support that they may need, and also inform the clinician as to what next steps might be appropriate for this patient. It's also cost effective because that same patient that you sent out for labs or so, they may be referred to someone else, but if that information, the results, can travel with them to their next appointment or their next referral, then it reduces the overall cost to our healthcare system by reducing duplicate tests. It improves safety because everyone can access the list of allergies that that patient may have or existing diagnoses. So health information is also available if I were to travel, let's say, to California on that grand day when everything is interoperable and I have an emergency somewhere else, somewhere far from home. My data can be queried and my health conditions, allergies, or diagnoses or medications can be accessed by whoever is offering me care. So that's the day I really look forward to. And we're making great strides here in Georgia. It also supports population health reporting, as we mentioned earlier. And with health information exchange, because it is supposed to be software agnostic, eventually, it reduces the cost of one-off system integrations when you do achieve full interoperability. And that's what some of those other standards, such as TEFCA, are the foundation for creating that kind of system that is interoperable because of the standards that are in place. It can improve the speed of access to complete patient health information and help in closing the referral loops and sharing specialist results with the primary care provider. It increases efficiency by eliminating unnecessary paperwork and handling. And also eliminates those chicken scratch problems we used to have years ago. So as we move on to our next slide, I'm going to invite Selena Williams because she is the Outreach and Engagement Manager for Highbridge HIE. And we're going to have her again carry on our theme is why the emphasis on health information exchange and what we're doing here at Highbridge.
Thank you so much, Phoebe, and I appreciate that. I've had the opportunity of working in the HIE space. I'm still learning the many benefits and the great opportunities that it offers here at Highbridge HIE. Of course, we are the regional HIE who is connected to GHIN, which is the state HIE. And as Phoebe mentioned earlier about traveling to California and being able to, her provider she got sick, then being able to access her records. We are now connected to the National Data Exchange, which is eHealth Exchange. So that is wonderful news for us. We're glad that we have that opportunity to be able to reach the national and the state. So I always thought that the opportunity was just through physician practices, but it goes beyond that. There's a lot of opportunities for being able to access data, retrieve data, send data, receive ADT alerts, again, through the hospitals. We connect correction facilities, physician practices, EMS and fire responders. And we also are working with care coordination organizations. So here at Highbridge, we're doing a lot of wonderful things to get organizations connected to improve quality of care through care coordination, reduce costs, and just move interoperability into a different direction. I'm going to turn it back over to Phoebe so she can continue to go over the other requirements and benefits for participating in the quality payment program. Thank you, Phoebe.
Thank you, Selena. All right, so we want to provide a few tips for health information exchange. In addition to the bidirectional exchange that's available through HIE by becoming a member, there is a free secure service provided by Georgia Health Information Network, GHIN, and it's called Direct. So it's a secure email, just clinician to clinician. And I'm sure many of you are already aware of it and maybe even utilizing it. And so whoever you refer to, your top 10 referring practices, let's say, make sure that they know about Direct as well, because there's no charge and it is secure. And it is a great way to exchange information between providers back and forth. And of course, you can look into becoming a member of a health information exchange, such as Highbridge HIE. And also, when you're doing the health information exchange, you really want to figure out the workflow within the practice. Is it the most efficient, the most effective? Is the right person touching this? Who is tracking the referrals? Some EHR systems are great at this, and some require more staff input and follow-up and tracking. And then who's reconciling the referrals? And what does your specific electronic health record require to make sure that the referral loop is closed? And another thing that benefits is, since there are practices you may refer to frequently and may refer to you frequently, then you might consider, how can we work more closely together and integrate to really become more like a community of care? Because that has benefits for the patients that you see, and also for your practices, bottom line. So as we move on, we have some other general reminders when you're doing your promoting interoperability category. Run and review reports frequently as you need to. When you're working on a specific measure, it might require more often, or maybe every 3 months, depending on what tight a handle you have on what's going on, and if there are things that change that you need to adjust so that you can see if your adjustments are having the desired effect. So run and review your reports monthly to monitor the progress on all MIPS categories, and especially promoting interoperability. Please, 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 please remember that only one submission method for the promoting interoperability category is acceptable. And if you do more than one, you'll cancel it out and lose all the benefit of the work that you've done. And if you're reporting as a group, the group data needs to be aggregated. So even before you report, you got to make sure that all the hard work you're doing in your practice is being documented in the right place in the electronic health record so that it shows up in your reports. I was working with a practice, and they were working on their referrals, closing the referral loop, and it just wasn't showing up in their report. They were doing it, but it just wasn't showing up. So we had to reach out to the vendor and make sure that the workflow did just the right thing to be able to capture what they were actually doing so that it showed up in the reports, because that's what will be reviewed, and that's what you need to keep as evidence in the event you're selected for an audit. And as I mentioned before, go ahead and review those measure specifications every year, because little things can change, and you might find some things that you want to improve in, or identify data points that maybe you were missing previously. And the PDMP, Prescription Drug Monitoring Program measure, is required. It's been required in our state for a while, but now it's required under the Quality Payment Program. You also want to make sure that your electronic health record system is certified to the 2015 edition Cures Update certification criteria. And if you are, let's see, yeah, I'll just read it because I don't want to confuse you. If you select the last continuous 90 days in 2023 as your performance period, the 2015 edition Cures Update functionality has to be in place by October 3rd of 2023. The 2015 edition Cures Update certification has to be obtained by December 31st, 2023. So again, I want to make sure we keep those little details in mind. And sometimes our vendors may not be as proactive as we want them to be. So be the squeaky wheel so that you get the grease. Make sure that they send you the information you need to document that the certification is in place. And also you can check on the CHPL website to make sure your vendor is 2015 certified. Let's see, our next slide, a few other reporting reminders for promoting interoperability. When you actually do go to report, it's so helpful to either have printed out your numerator and denominator for the measures that require that, or to have it up on another screen so that you can see them as you enter the data. Clearly define your 90-day date range on your reports, anywhere within 2023 calendar year. Again, you can visit the CHPL website or request it from your vendor. Make sure you have your certified electronic health record technology number on hand. Make sure that you make the right selection for whether you're answering yes or no. And if a numerator denominator response is required, that you enter the numerator and denominator and keep those reports, because what you run in order to save the reports, what you run in order to do your submission may not come out the same if you try to run it later on. So the report you run to meet your reporting requirements, save that report. Take the time, check your entries. And for all the yes, no questions, make sure that you answer them according to what is required. It's a little clearer now than it was before. It was really easy before to answer no for something you should have answered yes for, and vice versa. So you have to provide a yes or no response to the Safer Guides questions. You can't leave that one blank. If you leave it blank, you fail the entire category. So please, a yes, a no you can do, preferably a yes, but at least put an answer. Also, save your social, I almost said social security risk. Save your security risk assessment with the name of your practice, the date range. If you discover some vulnerabilities, make sure that you also include in your security risk assessment a mitigation plan along with the dates by which you plan to have those mitigations completed. And of course, save copies of all documentation for whatever you've submitted. Take screenshots of everything you've submitted. And you should be just fine. So we want to know if you have any questions for us or any observations as we have moved through 2023 so far. Is there anything you'd like to share with us as to challenges that you're facing or things you'd like us to cover in the future? Or any feedback on our presentation today? We'd love to hear it. You can feel free to throw something in the chat or in the Q&A. Selena will grab it for us. We're going to share the links to the resources that supported this presentation with you in a follow-up email. So anybody that registered, we're going to send you these resources that we use to create our presentation and also that help you meet the requirements. The Safer High Priority Practice link, the CDC National Healthcare Surveys Registry, which you can use to meet that 5-point bonus category. And also, I want to emphasize checking the validation criteria for promoting interoperability. That's a great way to make sure you have all your evidence and our audit ready. It also helps you to stay on top of it as you move through the year or the reporting period you select. So, Selena, do you see any questions for us, my dear?
No, we do not have any questions in the chat.
That's because we got pros on this call. And they've been doing.
Oh, wait, hold on. We do have a question. Hold on 1 second.
Yes. You know what?
Yes, Ms. Armstrong, the slides will be available. The presentation will also be available on our website, and I will drop that in our in the Q&A.
So it'll take us a couple of days. We'll send it off for editing, and maybe they'll take out some of the bloopers I've made. And then we house it on our website, as Selena said. So yes, it will be available. The recording will be available, and it'll be housed on our website. But always feel free. Selena, move on to our next contact slide, would you? Always feel free to reach out to us if you have specific questions. We can share a resource or we can try to answer that question for you. And of course, the quality payment program. Oh, yeah, we need to cover these. Help desk is very helpful as well. And one thing CMS promised us is that it would be a very dynamic program, and it really has been, and moving on to MVPs. And they've also done a fabulous job of updating the resources on the resource library. I know it's a lot to search through, but it is such a great resource. We have continuing education opportunities, and you can get certificates on this platform, the Format Approved. And by using our code, you can get a discount on your training, staff training, HIPAA training, even how to do credit card payments. You have new staff, you want them to be trained without taking all the time that you might have to spend with them individually. It's a great resource to take advantage of Format Approved. And also there are some trainings that are available for clinicians along the lines of how to work with patients who have disabilities. And so we're glad to share this with you as well. And you can obtain free continuing education credits by utilizing this training. And we'd be glad to follow up with the registration or the link to this site so that you can access that, or you can share it with your clinicians to access.
Thank you so much, Phoebe. Again, the presentation will be available. We thank you all for joining. This particular training here that Phoebe mentioned, we can send this out to you. The free continuing education credits will be for medical providers and physician assistants. So if you have any questions, again, our contact information is on this presentation. And again, thank you for joining. Have a great day.